Hello everybody, how are you doing? My name is Anastasia Markvarde and I'm super happy to be here today in this cave. Honestly, I was really happy that we're not outdoors because of this wind. Super excited to present something new and really worthy of your attention, and I'm really happy to see that you reacted so well about the potential of Finland. You might be aware, you might be not aware, that women's health is actually one of the biggest opportunities at the moment, both economically and as far as the impact of the society. So I'm here today to announce the first program on women's health innovation in Finland. I'm very fortunate to be able to help Business Turku in launching the first women's health accelerator for early stage startups in Finland. And our idea is to, of course, help early stage women's health innovation to scale. But besides that, we also understand that this is impossible without a proper ecosystem. And I know that many of you here are working really hard to make this ecosystem grow. So what we want to focus on is not just the acceleration, it's going to be a truly global women's health innovation program. And what do I mean by that? So we will run a 6-month acceleration program in a hybrid way, targeting women's health innovations in a very broad term, because we definitely know that women's health is not just fertility, it's not just pregnancy, it's everyone's health, and it's applied to any therapeutic area from brain health to cardiovascular to autoimmune diseases where women make up majority of patients. That's why we will accept any startups from around the globe, and of course we really hope to receive many applications from Finland as well. And these startups can join the program for free to run this journey with us of 6 months, getting help from the best experts on everything from business growth to clinical innovation, and of course access to investors, pilots, and cooperation with our partners. And one of the big things is that we have investors from all over the world joining our network. So we have top Finnish investors like Innovestor, Inventure, Voima Ventures joining us, but we also have investors all the way from Germany, Italy, and San Francisco. In addition, it's a really big thing to announce. We're going to be joined as an advisor of our program by Jessica Federer from the United States. She was a chief marketing officer on the global level of Bayer, and nowadays she's running a fund of funds for women's health. So she gives money to VCs to invest in women's health, and it will be a real pleasure to have her here in Finland for us. But apart from helping startups, we also really want to help Finland, and we want to help you. So what we can do for you? For investors, we're going to create a deal flow pipeline. So we're going to create a global pipeline of women's health startups so that investors can access that and they can invest in the companies that are here. And these companies can also raise follow-up rounds afterwards, and thus bringing capital to Finland. Also, by bringing such experts as Jessica Federer to Finland, we really hope to establish more and more cooperations and again bring more revenues to Finland and more capital to Finland. And finally, our program is able to help everyone, and we will be partnering with the leading pharma companies, with the leading life science companies, hospitals, patient associations, biobanks associations, because we will be delivering value to each of them. They can partner with our program in order to be visible in women's health, learn about the latest trends, and also have pilot cooperation with the startups. So with this introduction, I just wanted to give a little bit of a teaser of how the program will look like, and I hope that you can subscribe to our updates and hear more about us. So currently, if you scan this QR code, you can access to our newly launched website of Air Accelerator, where the submissions for startups are already open, and you can see an amazing list of mentors, experts, and investors that have already joined us, and some of you are there on this website, which we're very fortunate to report. And we also have contact for investors and partners. If you're interested to learn more about our initiative, please reach out to us. We are really sure that this is going to be something truly global, bringing value in women's health innovation for the Finland, Nordics, and in general on the level of Europe. I hope that this has given you enough excitement to be able to learn more about women's health and hear more about the opportunity from the speakers that follow me. So thanks a lot for your attention, and please reach out to us.
Thank you so much, Anastasia. Did you all get the code? Does somebody still need to? You can just stand up and take the picture, so we want to make sure that you get the code. And use it as well. So now we are continuing the discussion, as mentioned, about the women's health as the next global growth market. And for that, I will introduce the first keynote speaker. And after her, there will be a panel discussion hosted by the CEO of Business Turku, Minna Arve. But first, to give you a keynote, please welcome Aura Pyykönen. Welcome.
Kiitos. Hello, everybody. A true privilege to be here today. Thank you for having me. You have my face, and now you have my slides. Sex matters. Every cell in human body has a sex. Sex is chromosomal. It's not limited to sex hormones, as we tend to think sometimes. Chromosomes code our immune system, brain function, treatment response, how disease develop. Gender is distinct from sex. Gender is social determinants of health. It's work. It's the social expectations. It's the caregiving roles. And these both, gender and sex, have an impact on women's health. Funny enough, we've spent a lot of time explaining the differences through gender, and medicine has skipped biology, interestingly enough. Women were excluded from clinical trials, and even female rats were excluded from preclinical trials because the hormonal cycle complicated stuff. It made research difficult. And the thought was that it's unimportant. And that's how medicine was built on the thought that a woman is a small man. Woman is not a small man. Here on the top, we have what we typically tend to think as women's health. It's conditions like endometriosis, PMOS, previously known as PCOS. It's PMDD, it's PMS. It's menopause. But here in the bottom, which unfortunately you cannot see very well, unless I move the sofa there, but anyway, there's what I think is truly important in women's health, and that's the part that we've completely neglected for a very long time. And here in the middle, we have the hormonal transitions that very much define women's health. Women go through, instead of one hormonal transition, as everybody goes, puberty, women go through 2 or 3. Pregnancy, postpartum define a lot how our immune system works, how our brain works. And menopause, again. So these transitions play a significant role in our cardiovascular health, in our brain health, in our immune system. 80% of immune disease patients are women. Migraine is 3 times more likely among women. This is what we should talk about when we talk about women's health. And this is where we are today. Women do live longer than men, but women spend more years in poor health. They spend more years feeling exhausted, in pain, misdiagnosed, feeling dismissed, and functioning below their full capacity. And interestingly enough, this happens during what we call productive years, during the work years, during the years we build families and communities. And this is why it becomes an economic opportunity and an economic problem. And this is why it's becoming so interesting for the right stakeholders, the governments, the investors, the innovators, and even slowly, very slowly, but steadily, the healthcare systems. And what this could mean for the Finnish economy. Anastasia here first gave a little bit of a sneak peek into this, but we can see a huge potential. We are very focused in Finland in our healthcare discussion on where does the money go to. We focus on the budget. We rarely ask where the money comes from. We rarely consider strategic innovation within healthcare or within innovation in healthcare. To put these numbers into perspective, Finnish GDP is roughly 300 billion annually. social and healthcare costs comprise 10% of that, 30 billion. And now, with a very conservative estimation, we could achieve 2 billion more into this GDP, or up to 6. You do the maths, or somebody else. And why does this still look like that? Healthcare business it's a huge business. Between 2020 and 2025, private sector invested 3 trillion, that's a lot of nulls, 3 trillion US dollars into healthcare. And then this tiny slice there in the upper part, 6% goes into solving women's health. Why is that? It's because of this. We underinvest in women's health because evidence is limited. And evidence remains limited because we underinvest in women's health. This gap needs to be closed. And how it's closed? It's through public and philanthropic funding, patient investment money for early scientific risk and social risk. And then we need a lot of private investment to scale what actually works. And this shift I call to happen. Let's start celebrating innovation in healthcare. We need to be more comfortable in changing the current paradigm. We need to be more comfortable in changing stuff. In Finland, we're very focused on uniformity. It happens on every sector. It happens in education, it happens in healthcare. We often confuse equality with high quality, giving the same for everybody as high quality. It's not, it's average for everybody. We need to start thinking that we need to deliver our best for somebody and then scale it for everybody. Healthcare is not great at sort of abandoning the old ways of thinking. Research is better. The research is based on the concept of questioning the current truths and delivering new hypotheses. And this is how we create inventions. There may come a great finding which will become an invention. But invention is innovation only when it reaches people. And like it or not, this requires commercialization. We are not bad at inventions. We're actually very good at inventions. Hormonal IUD is a magnificent story of how research met the clinical need and how it was then scaled into a global success story. More recently, a ring was developed here. It was developed for recovery and sleep, mostly for men here in Finland. And then all of a sudden, when it scaled, it became the most interesting device for women's health. And now Aura sits on top of probably the most valuable and significant data set on women's health. That data set, that know-how, and that money sits in Delaware. Luckily enough, however, hormonal IUDs are still produced here in Turku, and they contribute significantly to our GDP. How about we start changing this? We start, instead of inventions, we start scaling them into innovations here in Finland. And then another topic, another mindset shift. Healthcare innovation does not begin with certainty. It begins with questioning. It begins with an unmet need. And trust me, there's an ample unmet need in women's health, so it's a great area. However, as we know now, historically, women's symptoms were not absent. They were just poorly measured, poorly understood, poorly researched. But absence of evidence is not the same as evidence of absence. So the problems did exist long before markets appeared around them. But this is the public conversation we're having at the moment, and I think this is a great example. This is perimenopause. The conversation is taking place here in Finland, but it's also taking place, funnily enough, with the pretty similar wordings in Sweden. We're very much questioning this. Is this a true issue? Now that we've opened this societal discussion around it, there will be solutions coming up. Some will be meaningful, some will be ineffective, some will be opportunistic. But the answer is not cynicism. The answer is better science, better data, and better health literacy. And obviously, we need better innovation ecosystems. Another mindset shift. Let's make health data accessible. We often claim that we own the best health data in the world, but it's not worth much if we don't use it, if there is no access to it. Well, funnily enough, while preparing for this presentation, I came across a fantastic, fascinating project, actually originating here in Turku, called Syndate. It's a project aiming to create synthetic health data sets for research and innovation. It sounds exactly the kind of project we truly need here. But I had to search remarkably hard to even understand whether this project is still alive, where innovators or researchers could engage with it, where is it located, and how to reach out to them, how to access that data set. So another uncomfortable truth. Communication, usability, and branding, they're not commodities. They are not something like nice to haves. It's crucial part of the infrastructure. People need to know about stuff before they can use the stuff. I don't want to undermine the importance of data privacy, of the truth, of the public trust to how we use the data. I just want to say that with the Secondary Act, Secondary Usage Act for Health Data, with great aims to have a general governance, have a general access, general ownership of the data, it became very slow, expensive, and arduous. And by this, we also limit who gets to use the data. If it's not accessible for the small research groups, for the small innovators, for the startups, to mention, it's not there for the people that we need it for. And then finally, let's start valuing what actually matters. And if we start valuing what actually matters, we need to start measuring what actually matters. Quality of life. For decades, healthcare systems have largely optimized for survival. And of course, that matters. I'm not saying it wouldn't. But how do we keep people remaining functional, independent, mentally well, and participating in life? That's the real challenge. It's not a soft metric. It's a social metric. It's a workforce metric. It's most of all an economic metric. And increasingly, it's a sustainability metric for how well healthcare systems perform. And it forces us also to rethink how we prioritize, and it forces us to start prioritizing, because that's what we need to do very soon. So this is what I'll leave you with. It's very small there on the top, but please, 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 let's not refer to women's health as a niche. Let's just not say that word anymore, because it starts to repeat itself, and it remains a niche if we constantly talk about it as a niche. It's not a niche. What we need to do now is we need to celebrate innovation. We need public-private partnerships, and actually, we have a tool for that. It's called Research the Business. We need more Research the Business project for women's health, to have those ideas develop into business, to have them in the pipeline and in the deal flows for those investors in Finland and those international investors that Anastasia has brought to us through the accelerator. We need to generate better evidence. We need to be prepared to use the real-world data that we are very great at storing in this country, and we need to make that data usable. And finally, let's start prioritizing quality of life. That's it. Thank you.
Thank you so much, Aura, for making us ready for this so important topic that we are having today, women's health. And as Aura closed, women's health issue is not a niche issue. We are half of the population of the world, so it's not about niche. But it's not also about philanthropic. This is really a huge growth possibility. So we are today about discussing not only the women's health as such, but also the growth potential, the innovation potential for companies around it. And of course, in that sense, the growth of Finnish and European companies in general level. 3 numbers. They were, at least some of them were already mentioned. But let that sink. Women's health receives 6% of all private healthcare funding. Even though women are 50% of the world population. Secondly, women's health specific companies receive less than 1%. So that's around $23 billion out of those nearly $3 trillion. Quite shocking. And closing the gap would unlock over $1 trillion in global economic value. So, this is not philanthropy. It's about really white space that we in Finland can now start writing with colors. I have an honor to invite here 2 amazing speakers for our panel. And I will start with Anastasia Markvarden. Anastasia is women's health innovation expert with a background in top pharma and startup advisory. Anastasia represents Finland in global femtech ecosystems and has connected Women's Health Hub Finland to the Milken Institute's international network. And she's a women's health thought leader and author of the Women's Health Digest. Anastasia, you have extensively experience from women's health initiatives. Are we seeking a structural shift in how capital flows into women's health, or in this still largely driven by individual champions is now going?
Yeah, thank you, Minna, for this question. It could take really a lot of time to answer it, but I'll try my best to do it in a very short few minutes. So I think it's both, remarkably. So first of all, I think we do see quite a shift in terms of how many investors are now looking at women's health. So if you look at the US, of course, they have quite a few investors that are focused exclusively on women's health, such as Foreground Capital, Amboy Street Ventures, and so on. If you look at Europe, you can see that we have the first women's health dedicated investor in the UK, Goddess Gaia Venture. We have the first fund in continental Europe being raised now by Femtech France in France, with the participation of the local government with 5 million investment, and with a target up to 40 to 50 million. So that's quite significant as a first step. And we have more and more investors that have been traditionally investing in health tech, and they are now looking at women's health. And if you look at our website, you will see quite a few of those. But at the same time, of course, I think there is still a lot that we need to work on, and this mind shift doesn't happen overnight, and there are so many people still that need convincing. I think that it was just last year that I spoke to an investor that was saying that preterm birth investment was too much of a niche for them. And if you consider like preterm birth, it affects, I think, around 10 to 15 million people worldwide, compared to, for example, some exclusive male conditions that get a lot of investment and just get a fraction of those patients. So I also think that there is a lot of controversy around this women's health framing, and indeed in the US they're starting to call it health of women, which might be not a bad idea, because it reflects specifically that we're talking about health of women, and it covers all the therapeutic areas, not just fertility or gynecology or anything like that. And I believe that we all need to understand that this is not like a new fancy term or like something that is in fashion, but is a real clinical need, basically, of me as a woman going to emergency and not dying of heart attack because my symptoms are considered atypical and not being diagnosed. So I think this is an important message for everyone to understand, that women's health is something that happens each time you go to doctor as a woman, and it's not just something, trendy that we need to post about.
And secondly, Tuomas Nyman. Tuomas is the CEO of Finnish ethical AI company whose innovators support healthcare, education and women's rights, including in low-resource environments. Neuvo develops offline capable AI applications at the intersections of data privacy and human-centric technology. Tuomas, Neuvo operates globally. What does the demand side actually look like, and has it changed?
You can hear me, right? Yeah. So, well, we actually operate more in the African side, so on the developing countries, and I know more about those ones. So, but the demand, if of course, is there, like Aura said, it's growing, and something needs to be done there. But the way I feel that we could master sort of the growth is that we could inject more early money into the innovations. So in that sense, the biggest problem in Finland, like we all know that there are great minds in Finland, great innovations come from here. But the problem is that we need to sell the innovations and the spiritual and the mental capacity already in the early on to the domestic investors. So we lose the control of the innovation, of the data, of the IP, and that's a super big problem in my head. And if we can, not do that vendor lock and just inject more money early on the innovations here in Finland, I think that we have all the things that we need to really start operating globally and make it big. So there is a lot of room to work, a lot of things that need to be done, but we all know how to do it, so let's just do it, like Aura said.
So it's only for us to drive this growth for the future. And when we will have, of course, Aura here. Aura brings an expertise and critical perspective to the conversation. So her role is to challenge us here now a bit. My name is Minna Arve. I'm the CEO of Business Turku. We are coordinating the Women's Health Hub Finland, which is quite new initiative. We have experts working on different kind of projects, and AIR Accelerator that Anastasia here just launched is part of that hub that we have. But now let's dive into the discussion more deeply. We have some 20 minutes time, and I would like to discuss a little bit about the ecosystems and the new business models that could be found here. So, if I start first with Anastasia, what does a functional women's health ecosystem actually require? And where the partnerships create value that companies can't alone do?
It requires more programs like ours, for sure. I think that, as it has been mentioned here by the speakers before, we do have research to business, and we do have really amazing instruments that support early stage, especially science-based innovation. And I've worked across Europe, for example, quite a lot in Italy. And believe me, the Finnish system is quite good with all the flows it has. It is quite good if you compare it to many other countries. However, I think what we're missing is the next step. So the vertically focused acceleration, which means that, first of all, we focus on specific domains, so like we do with women's health, because expertise that companies need to scale in women's health is very exclusive. These companies are unlikely to benefit from a generic accelerator because you're probably familiar, but in general, for example, femtech ventures end up submitting double the evidence to clinical regulators to get approval for clinical approval of their solution, just because the reimbursement pathways are not designed for them. At the same time, the reimbursement codes in the US reimburse up to 40 to 150% more on male reimbursement codes rather than female. So there are huge discrepancies, and there are so many challenges these companies need help with on top of the usual grind of this building the startup. For example, there is censorship of in the social media of different terms and and awarding related to women's physiology and women's health. So that's why I think that it's important to have this type of programs, and of course not just on women's health, but the ones that we're already seeing grow across Finland on, you know, food tech, marine tech, defense tech, and so on, because they should attract expertise that is available exclusively for these kind of companies. And then, of course, yeah, the next thing is what has been mentioned again here is scaling, because Finnish market is small, and we need to understand that these companies need to scale immediately, either in Europe or, as they all really like to say, to the US. But it's very difficult and challenging for those early stage companies to scale abroad. That's why we exist, and that's why we want to bring people who can help them to survive this so-called valley of death and scale, and, you know, repeat the success of Aura and others. Yeah, thank you.
Okay, Thomas, we have a strong health and life science cluster here in Turku. Where is the most concrete opportunity for a region like this to build a real positioning, not just a narrative, but...
I think that anything health related that comes from Finland is always treated with utmost respect when you go abroad. People trust us, people trust the innovations that we do. Like I said earlier on, great minds from Finland. So you pick your spot and just make it happen with platforms like Anastasia is bringing up. But I have to, you know, emphasize the idea that, well, at least what I have learned is that in Finland we always think that we can do something really good, and yeah, that we do. But when we go abroad and start doing our stuff and things there, we quickly find out that it's not always the best way. You have to, you know, take care that you understand the cultural things where you're going. You have to understand the regulations where you're going. The legal side is completely different all over the world, and these kind of things is something that you have to learn when you start working or operating, you know, abroad. And I think that, well, I have to say about the ecosystem part that to me the greatest ecosystem would be like that there is two sides. There is the companies, there is the innovations, there's the ideas, and there's the partners in that sense, but there is always the governance side as well. And in the governance side, there should be like streamlined regulation roads and these kinds of things, because they cost a lot of money to get these regulations done for the innovations and the solutions. And because of that, you just have to have like super strong investor side with you. Because if you don't have that and you don't get the solution regulated on time, you lose the market, because we are growing so fast at the moment in all over the world actually, that if you don't have everything put in place while you start the thing, then you will lose the market. So you have to be quick, and to be quick you need to have access for the funding. So I always like I'm just, you know, speaking about the money, but it's a huge deal, and in Finland we are sort of scarce of it. So, well, that's about it. We can do anything, anywhere. We just have to have the mindset for the thing.
And please catch up with each other's comments if you feel so. But now, Aura, you can challenge that. Are we talking about the right issues? What would you bring up here?
I think we are. I would maybe follow up on what you said, Thomas, there about the sort of understanding the cultural context or understanding where you're going, and I would sort of generalize that over like understanding the unmet need. So you cannot go into your lab and innovate. You make an invention there in the lab, and you come out like, this could be a solution, but is there anybody who actually needs this solution? And how is it delivered to these people? How do you deliver in that setting, in that sense, in that thing? So I think we should improve how we talk to people, how we actually ask what you might need. So I think that's one sort of generalization over that. And then another anecdote, if you don't mind, because going back to what Anastasia said about the how the femtech companies are required more data, which is kind of like an irony there, because there is less evidence, and still these companies are demanded to have double the evidence. So it's really, they need to start by creating their own evidence, which is really arduous and really slow and really expensive as well. So there comes also the part that it's also the terminology that what you mentioned, that it's really hard to talk about vaginas. And sometimes male investors find it really hard, and then they just tend to avoid that area, not to be sort of offensive or use it wrongly. And I think it's hilarious how we have a person called Monika Liikama. I don't know how many of you are aware of her existence, but she's a great mind. She's now an executive in residence at Aalto University. She built a fintech company called Enfuse, and now sort of left it in great hands and started building something in women's health, which is, dear Lord, a great thing. A person from a heavily a tech person, a woman herself, but a person with money, because that's also a quote from her: first you make money and then you make impact. So now she's investing her money into women's health. Dear Lord, thank you. Or thank you, Monika. But what she's doing is she's building a solution for urinary leakage, which obviously is one part of women's health. And she's making an injectable thing to prevent it from leaking. And we have one product on the market today, and they are going to be the only competitors for that. And how she's pitching about this solution is basically, we put birch, because it's made out of birch, we put birch into pussy to stop women peeing their pants. And I think this is a very welcome conversation. So it's like, just name it and talk about it. And then we can all slowly get to be more comfortable about it. Yeah.
Yeah. That we here are a lot of women in the audience, which makes it more comfortable for talking about issues with their own names. But sometimes I think that there is still room for this kind of discussion when there are more diverse audience here. But I now hear the call for action, action, action. So what does that need the next step? That if there is someone in the room today who kind of wants to know what she or he could do personally in order to kind of either raise the awareness or maybe start a startup or some unmet need. So what would you say that what could everyone do, or how to start like the really innovating something? Maybe Anastasia, you can start.
Yeah, definitely. I think that raising awareness seems like have maybe not that important as building some innovative solutions, but in reality is huge. Because I have been fortunate to, sometimes be invited to speak at some university event, talk to researchers, student of medical science or business science, and yeah, they're largely unaware of those issues. So they're basically going through the whole 3-5 years of their education, and they're not aware of this huge gap in women's health. And maybe if they were made aware in the beginning, they would already think of working in this area or thinking on a startup in this area. So I think raising awareness is a big deal, even if it seems like we're just talking. But if you do it in the right way, it can bring a lot of change. And especially, it's nice to see when the students are like, oh, really? So there's so much opportunity there. Maybe I should go do something about it. And definitely, starting a startup, it might feel a bit discouraging after everything we've said here about challenges. And we first talk about how difficult it is and how challenging it is, and then we're like, yeah, just go start the startup. But don't forget about the enormous opportunity and
the community.
And the community. So, and in general, in terms of money, like we've just discovered that there is a huge market of 600 billion, according to some estimates, for half of population. So basically, if you are successful, it could be really big. For example, in Canada, they estimated that if women's health needs are covered, the impact for the economy would be more than from implementing AI in healthcare. So that's like really big. So I think it's betting big. It's not going to be easy, but I think people need to be made aware of this huge opportunity that if they get it right, it could mean a lot. And I mean, look, even at Finland, it's not such a big market, but for now there is not an immediate telehealth service even for menopause, for example. So just even that solution could already bring a lot of traction. It doesn't have to be a rocket science from day one.
So if the potential for economy would be bigger than AI, so what is the excuse that companies have that they don't go into this field? Have you?
Yeah, I think it's the usual number one.
I think that Tuomas
They
now
are
already the
scared.
ball.
Usual number one killer of innovation. We've always done it this way. So yeah.
I gotta say about the founding your own startup that I completely agree with Anastasia. You have to get connected. You have to spoke out loud your ideas, and at least on the paper side, get the proof of concept and ask for help. No, people tend to help if you ask, but we Finns are sort of people who don't really ask help. So that's another mindset that we need to change. We have to learn to speak.
Before giving Aura the closing comment, I would like to now, if there is any questions, we could have 1 or 2 questions or comments from the audience. So I hear there is Pasi and then there is a lady there also. So you have the 2 ones. Sorry. Now it's only for those who are the quick ones.
Hi, and thank you for this great panel. My name is Tytti Massinen and I'm from Actim. My question is about terminology and mainly about using the word women. The reason why I'm asking this is that I have learned that some research applications have been rejected if you have been using the word women in association with pregnancy. So instead of using the word pregnant women, you should be using pregnant people. And this example comes from Canada. So what is your take on that, and how do you see we should be using the word? Should we be proud and talking about women in order to have this women as a word more prevalent, or should we be somehow more gender neutral?
Very short comments, everyone.
Yeah.
Tuomas starts.
Do I have to? Because I think that's stupid. Yeah, sorry.
Yeah.
There are men, there are women, and that's it.
I think it's a technicality, and it kind of maybe drives us a little bit away from the real need in women's health, because instead of solving things, we were arguing about the terms. And of course, I understand that some might need to switch them when applying for grants, but yeah, in my opinion, it kind of drives us away from the main point of the conversation.
Okay. Aura.
I would fully agree. That was actually my point. It's just it's out of the point. Sex and gender both play a role, so we cannot just talk about the chromosomes. We cannot talk about the XX people instead of the XY people. It's really, I think it's really sort of, we cannot be ignorant and we cannot be offensive, and we need to be mindful in the way we talk about different genders, and we need to understand that there are more genders than 2. But then again, we shouldn't be focused on these, and if you check the instructions, they typically say it there that what kind of vocabulary they want you to use. So yes, jump over this, I would say.
Good. Then we have the second question going there.
Yes, so just not the question, but perhaps comment that the big pharma is still afraid of start new things which are related to women's health. So the novel targets, early discovery programs. So that's the fact. And so that's why there is a lot of space now for the scientists, for the startups, and we should encourage those really, to push the things and start the new things. But also to encouraging the investors, because that's really what we have been talking already today, that we need money for that. So I think there is a space and room for the small players, to make the innovation. So that's where we should focus now.
Thank you. And now just a short closing comment from everyone. How does the women's health growth opportunities look like in 5 years, and how they have, or actually not opportunities, but how these opportunities have moved into the action stage? What would that kind of thing, success look like in 5 years here in Finland? Everyone, shortly. Thomas starts.
Okay. Well, I think that we have stopped treating symptoms and we are going more on the proactive wellness side. Everybody understands all the things that Aura said in the keynote, that there are a lot of things to learn, a lot of things to start just doing. But well, if we put our minds together, I am fairly sure that great things will happen.
Great. Then Anastasia.
I think so far we talked a lot about women's health on the level of like startups or individuals or researchers. So I think now we'll talk about the government approach. I definitely think that success for us looks as having a women's health strategy for Finland, a dedicated one, and integrate it into the EU women's health strategy. And of course related clinical guidelines and government policies that encourage integration of women's health in research, clinical trials, and workplace.
Right. And Aura.
Really happy to follow up with that one because the ministry in Finland is currently building the strategy and it's going to be published next year. So it's happening. The strategy is coming up for women's health in Finland. We can be very proud and happy about that. And secondly, I can follow up on the telehealth for menopause. I run a company for telehealth for menopause in Finland.
I was waiting to hear a comment about that.
Dear friend. And then my final comment on how will women's health innovation system look like in 5 years. We have a pipeline. We will have a system where the early innovators have access to public testing and piloting, and this gap needs to be closed very quickly. And then from public funding, the gap to private funding, from that public thing being something that can actually reach people that actually pay for it, which is one gap that we have. When we have public funding, sometimes the companies cannot receive money. So we need to be sort of smoothing out those gaps and those intervals that we have there in the middle. So that's called pipeline. So we need to have those transitions cut up, and then we have a ready product that has branding, that has communication, that has marketing, that has all the parts of commercialization. So we don't need to go and buy, innovate here, send the innovations out, have them build them there, and then buy them back, but do the whole thing ourselves here in Finland.
Amazing. Let's give an applause to our great panel. And now
And also to Minna. Another round of applause. Thank you so
I will
much.
just leave you with the thought that how could you have a part of doing this successful path into the future with women's health and be part of that. Thank you very much.
Thank you.
Thank you.
Thank you. That was hugely.